With their bloodborne infections, these are spread between contact between blood and or bodily fluids and non-intact skin or mucous membranes. And it's important to note, always take standard precautions, right? Using your gloves when you're going to have contact with a patient's blood or bodily fluids. Now, personally, if I'm going to touch a patient, period, at all, I'm going to wear gloves, just because some folks are gross. But I'm going to wear gloves. It's a habit. All right. I'm going to use eye protection whenever blood or bodily fluids are likely to splash. So when I'm intubating somebody, I'll wear goggles. Even, other things that you don't really think about, you might want to consider it. I remember very vividly in the back of Jack's one day, a restaurant, which was very slippery, by the way. We had a fellow we get called out for unresponsive. So we get there, and apparently it sounded like he had a seizure. And when he fell, he flailed a bit, and he knocked over a big vat of mustard. So there's mustard everywhere. He had vomited, and he's laying on his back in the middle of this wet floor with vomit and mustard everywhere. And it was very narrow, so there was nowhere to go. And so I'm kneeling down by his head, and as I go lean in just, to assess and see about if we can roll him over to help clear some of that airway, he coughed, and vomit which was in his mouth, came up and sprayed me in the face, including in my eye. It took every bit of everything I had not to lose my crap, but I didn't. I held it together. We managed the patient. We got him, to the hospital, and I ended up having to do a contact form, exposure form. I had my eyes flushed out, which sucks, by the way. If you've never had it done, having your eyes flushed out for 20 minutes sucks. But now I wear goggles. I'm very careful about that kind of stuff, and I would rather wear goggles and look like a goober than not wear them and get some kind of infection that I can't get rid of. We need to make sure that we carefully handle sharps. Needles will poke you. IO needles will poke you. Sharp edges of things can cut you, so be very careful when you're handling anything sharp. Make sure that you are washing your hands appropriately. And really important, make sure you're disinfecting contaminated surfaces. Stretchers, straps, mattresses, equipment, all these things that can become contaminated. Hepatitis B, 16 days it can live outside of the human body. So a shift 2 weeks ago, if somebody had a patient in that truck with hepatitis B and stuck let's say they started an IV on them and they bled some and they didn't get it all the way off of the cot. And then you go, they didn't wipe the underside of the rail of the stretcher because nobody ever does. Take this. Next time you go get on an ambulance, go look. Flip that stretcher upside down, not with a patient on it, but just flip it upside down and look on the underside. I would bet on probably at least half, if not more, of the stretchers, you will find blood. You will find dried blood on that stretcher, which is gross because people don't wash them appropriately. They don't disinfect them. But anyways, back to the point. 2 weeks previously, somebody could have had hepatitis B, bled on that stretcher, and if it was not disinfected, you could become contaminated. Let's say you have a hangnail or a cut on your hand, and you go to grab that stretcher to raise it up or to move it without a glove on. You should wear gloves, but that's another story. And then all of a sudden, oops, there's your contamination from 2 weeks ago. Y'all clean your stuff. Insist that other people clean their stuff, and don't trust that anybody ever actually does, because they don't. The first part of my truck, when I'm cleaning off and checking my truck, I wipe down every surface that I can get at with some Cavicide. Clean your truck. Now, there's a couple of major bloodborne infections we want to be concerned with, and of course the first one is HIV, and then of course AIDS. So your HIV, or human immunodeficiency virus, is going to infect your T lymphocytes. And what this does is it combines with a molecule on the cell surface so it can gain entry. And then, like most viruses do, it's going to start using that cell to replicate itself, making thousands upon thousands of copies. In the process, these lymphocytes are damaged and they decrease, which is what actually suppresses your immune system. At a certain degree, and I don't remember off the top of my head what point it is, but at some point, that suppression is enough where it turns into acquired immunodeficiency syndrome, or AIDS. And there are a lot of times they're actually kind of referred to as the same thing, but there is a progression there. Now, the thing about HIV, why our bodies can't readily get rid of it, they mutate all the time. So our immune system, by the time we recognize it and make a memory for it, it's already changed again. So we can't destroy it like it can. Now, there are, some drugs that can limit the replication, some antiretroviral drugs, but due to those mutations, they don't always work as well as they might, or as they could if they didn't mutate. Because of this weakened immune system, the HIV and AIDS patients are much more prone to numerous infections and cancers, including opportunistic infections and rare cancers, and eventually even the central nervous system can be affected as well, which can lead to an age-related dementia. Now, in patients who do not have a diagnosis of HIV or AIDS, some of the signs and symptoms that you might want to consider as a possibility include fever, night sweats, lymphadenopathy, recent history of unexplained weight loss. You know, a lot of people live with their head in the sand, and so they just don't want to get tested, because then as long as they don't know for sure, they can say, I don't have it. But if they get tested and it turns out they have it, then they can no longer have that denial. Denial is very strong in some people. If you are sexually active or in the healthcare field and you've never been tested for AIDS or HIV, you need to go get tested. It's painless. They do a cheek swab and it takes like 20 minutes. It's much better to know and be sure than to assume. Everybody knows what happens when you assume, right? Now, when we are caring for our HIV and AIDS patients, one of the biggest problems is often because there's some kind of other infectious illness or complication going on because of their compromised immune system. Pneumonia, tuberculosis are very common, and Kaposi sarcoma is a little more common with patients with HIV and AIDS as well, and is rarely seen outside of patients who have this. Okay? Now, with your HIV and AIDS, it's not spread through casual contact. You can touch skin to skin on somebody, just like your hand on their arm, and you're not going to get AIDS. If the skin is not intact, you need to wear gloves. Okay? Once again, I go back to you should wear gloves on every patient every time, but that's another story. Wear gloves if you're going to start an IV, or if you're going to perform any other procedures with the risk of bodily exposure to bodily fluids. Make sure that you wear appropriate eye protection. Okay, and I've had some students in the past that are like, oh, if I know they're good AIDS, I'm just not going to start an IV on them. Well, number one, that makes you a crappy person because you're not doing your job. All right, number two, you could lose your license for that. Number three, if you do it properly, you won't catch AIDS from them. You don't have anything to worry about. And number four, I think I'm at number four, but lastly, most people don't know if they have AIDS. I found that some people, now I've had some patients who had AIDS and I went to go start an IV on them and they're like, I just want to tell you I have HIV. And I always tell them, I kind of pat them on the arm and I tell them, thank you for letting me know. But we do need to get the IV for you, but I do appreciate you letting me know, but it doesn't change anything I do. And they're all, okay, they just want me to know. And then I've had some, I remember one lady in particular, we went out to her house and was going through the whole questioning history. I don't remember what the call was for. It was something fairly mild, but maybe like some nausea, vomiting or something. And I asked if she had any medical history. No, the only thing she had was hypertension. All right, so we get her loaded up in the ambulance by herself. And then I went to go start an IV on her because I was going to give her an antiemetic and some fluids. And she was like, oh, I need to let you know I have AIDS. And I was like, well, in the house, I asked you, and you said you didn't have anything. She said, my husband doesn't know, which that's a whole nother level of ethical dilemmas. But, some people will tell you, some people won't. And then there's the people who don't know because they've never been tested. So you can't just say, I'm not going to start an IV on somebody. You don't know. You may not know. So you should treat everybody like they have something you don't want. Every single person that you start an IV on, you should treat like they've got something you don't want. Now, with your hepatitis, we've got hepatitis, a lot of different varieties, if you will, of hepatitis. The A and E are spread through fecal-oral route, and so this a lot of times is contracted through contaminated food. So what happens is somebody has it, and then they go to the bathroom, and they get their hands contaminated with fecal material, i.e. poop, and then they go and prepare food or something like that, and then you can actually cause infections in other people that way. In fact, not too long ago, I remember reading a story, Montgomery, Alabama, there was at Panera Bread, I think it was. There was a worker there who had hepatitis A, and several, I guess, customers had gotten sick from eating there. And they had to put out like a public health notice saying, hey, if you've eaten here within the past 21 days, you need to see your doctor. So it can happen. It can happen with people not washing their hands, which is really gross. Makes you kind of not want to eat anywhere. Now, your hepatitis types B, C, D, and G are all spread through blood and bodily fluids. Hepatitis B can be contracted through your contact with blood and bodily fluids of individuals, and this includes sexual contact, medical procedures, shared IV needles, tattoo needles, acupuncture needles. Hepatitis B is very, very virulent. It's very powerful, and it can survive outside of the body for a long period of time. There is a vaccine available for both A and B. Now, A is typically only given in certain circumstances, say if you're going somewhere else, like if you're going out of the country for missionary work or something like that, or in certain circumstances. Hepatitis B, though, is recommended for all healthcare workers, and you really should have it. It's a series of 3 shots, and then you should have titers drawn periodically to make sure that you are, in fact, still protected from it. Now, hepatitis C is transmitted primarily through blood contact and IV drugs, but in some cases it can actually be transmitted through sexual contact as well. And it can become chronic, and it can lead to cirrhosis and liver failure. Now, there is no vaccine for hepatitis C, okay, but within recent years they've actually found a cure, essentially, for people who have not been treated before. The problem with hepatitis is that you may have a subclinical presentation, and that you don't have signs and symptoms until you go into that point of liver failure or other issues. So, important to get routine health checkups as well. Now, your hepatitis D. Alright, hepatitis D is only going to happen in the presence of hepatitis B and has similar routes of transmission. Hepatitis G can occur alone or in conjunction with other types of hepatitis, but it's not super common. There's no vaccine for it. Your symptoms here, some patients are asymptomatic. Some patients have signs and symptoms that are like flu-like, headache, fever, joint pain, malaise, things like that. They may have your right upper quadrant pain. The urine can be very dark, and what's happening is the red blood cells are destroyed, and they can't be broken down any further and eliminated by the liver. The stool may be clay-colored because they don't have the bile pigment that would normally give them their color. A lot of different things going on here.